Welcome back to the Lift Free and Diet Hard podcast. I'm your host, Andrew Coates. Join me along with industry leaders and friends on a quest to get more people through the gym door and eating and living healthier. Join me where evidence meets empathy while rejecting fitness industry fads and extremism. Let's begin. Dr. Caleb Burgess, it's great to have you back. It's been a little too long. We're catching up off air. It's great to see your smiling face, even if it is virtually over the internet. And for those of you who, listeners who are not overly familiar with you, you're a doctor of physical therapy and a certified strength and conditioning coach, which is a combination I love. And quite frankly, if I'm dealing with physical therapists, I really like to deal with ones who are also strength coaches or value resistance training. So I've had several on: Dr. Susie Spurlock, Adam Meekins, Dr. Sam Spinelli. There'll be more coming up. Dr. Justin Farnsworth will be on at some point, and you guys all share that in common. And it's great to have you back. Thank you.
Yeah, thanks for having me on, man. I'm excited to be here.
Good. Let's dive right in. All right, quote. This is something I pulled from your media. It's a bit of a long one. I can say with confidence that most people overestimate the effect of specific treatments like massage, adjustments, cupping, taping, and underestimate the effects of their lifestyle, in brackets, sleep, stress, exercise, nutrition, repetitive movements, sustained postures, which I'll come back to. And then it continues, people forget that being an overall healthier person means you'll typically have less pain and resolve better. Unpack this for me.
Yeah, so I think too many people look for a very specific thing to fix a problem versus just realizing that a lot of times it's just how you're living your life. Now, the nuance there is that there's people that are actually taking really good care of themselves. And in those cases, maybe something more specific is needed. But I think as a whole, so many people that I see, even if they are taking care of themselves, there's usually areas that we can talk about that are a little bit more holistic, that aren't just the typical what you think when you go in and see like a physical therapist or a chiropractor. You think, okay, they're going to do something, they're going to adjust my back, they're going to massage something, they're going to give me some sort of treatment that I need to fix this issue and I'll be good. And yes, there are things we can do that can help you, but a lot of times the underlying issue could be something where you're overly stressed out at work. You're doing something that requires a lot of repetitive movements. You're, again, like I was saying in the post, you're in a position for a really long time, just like simple things like that, or your nutrition is off, or maybe there's some sort of food sensitivity and all that kind of stuff. Of course, that's not my specialty, is food sensitivities. I'd be a nutritionist. But I mean, there's just so many things that just people don't realize. Just being an overall well-rounded, healthy human takes care of a lot of issues. And I think a lot of physical therapists in particular, and this could just be my bias because it's the world that I live in, they miss that because we were taught to see a problem, identify a problem, fix a problem. And that's okay to maybe have that buy-in on the first visit when you see somebody and help them kind of buy into like, oh, here's this thing I can do to help you right away, help you feel better right now. But if we're looking for like a long-term improvement, sometimes we need to dive deeper into other issues in their life. That's just kind of like, again, focusing on lifestyle and how to be a healthier person. I think that's where a lot of times trainers and coaches can do a really good job to help with that too. And a lot of times when someone goes to see a trainer or they start to follow a program or start to try to take care of themselves and they have had a nagging issue, after some time they realize that nagging issue either becomes fully resolved or gets a lot better. They don't actually have to go to see somebody who's specialized to help them, quote, fix that.
Do you think with the practitioners who have a strong belief in their ability to use things like manual therapy to actually like resolve, heal injuries, is it almost like a belief that props up, it's confirmation bias in a sense, right? Can you give us a little bit more of a breakdown as to why some practitioners will claim that their interventions are more effective than the evidence points to?
I think a lot of it has to do, there's a lot of reasons for that. I think one of them would be like the sunk cost fallacy. You dump a lot of money into learning a course or getting a certification or spending years of your life learning something, and you've been taught that that actually is how things work. Number one, you're going to believe that because that's what you've been taught. But then if you're presented with contrary evidence to that, it's hard to change your beliefs because you don't want to admit that you just spent 2 years, 3 years of your life dedicated to this approach or this technique that you think is superior to everything. And then you start to dive into the literature or learn from other people who think differently. And you go, oh, wait a second. is this actually how things work? And that's a tough pill to swallow. I think that's a big one. I think there's more to it than that. I think that's a big one that I think kind of helps, not helps, but it hinders people from actually seeing outside of what their blinders want them to see.
This episode is brought to you by Just Bite Me Meals. I work long days and I won't compromise my client experience or sacrifice my workout, sleep, or nutrition. So I needed a quality and reliable meal prep service so I could save time on cooking and shopping and have more time for the stuff that matters. Net out the cost of groceries and the service isn't as much as you might think, and regular impulsive food delivery apps, eating out, that costs way more anyway. I get more meal variety and less dishes to clean, and I've been referring clients to Just Bite Me Meals for a long time, and I recently started ordering myself. Food is great. The beef brisket tacos are my favorite so far, and there's a lot of menu choice. Your calories and macros are listed. The portions are great. You can order custom meals. They deliver to your door, or you can pick up from their storefront. And I'm sorry to listeners outside of Alberta, but Just Bite Me Meals is currently just in Edmonton, Calgary, Grand Prairie, and Fort McMurray. Ordering from Just Bite Me Meals made my life easier instantly. And you can get 10% off on all your orders using my code, AndrewCoatesFitness, all caps, on their website. That's Andrew Coates Fitness, all capitals, or go to the link and the code in the show notes. There's also a concept that I love highlighting whenever we're dealing with pain, injury, is regression to the mean. So that way, someone takes something, they're in pain, they go and see their chiropractor, their, physical therapist, their massage therapist. And it's not to say these things have no value, but can you explain, because you're nodding, you know where I'm going with this, explain what I'm going to dive into.
Yeah. So there's regression to the mean. There's also this natural history. And so basically enough time passes and a lot of things we will resolve if you don't do things to constantly make the issue worse, or again, you're just trying to continue to live your life and manage those symptoms that you're having. A lot of things will just get better over time. Not everything. People tend to take too much of a black and white approach where I might say something like that and they think oh, well, you're just saying that everything that people provide is worthless and they just need to give it time. And it's no, it's just that a big part of it is that. And I've seen this in my practice when I see people on both ends. So maybe I see somebody early on in the process and they're going to need quite a bit of time, but it's hard for them to wrap their head around that no matter how much I explain to them about hey, I can do these things and have these strategies and put this program together to help you. But there's only so much is going to be accomplished in this amount of time. Part of this is going to be a time thing. And so some people might get upset with that. And then they keep seeing different people. And then eventually months down the road, they see somebody. And at that time, when they see that person, they're at that where things are resolving. And so they think this is the thing that fixed my problem, which, and I've been on the other side of that, where I've actually tried to downplay what I've done. Not that I don't have confidence in what I can do, but someone has seen a bunch of other people and then they come to see me at the right time, at the right part of their healing or recovery process or whatever's going on. And they make really good progress pretty quickly. And I'm like, what? Don't think that what I'm giving you is this absolutely amazing thing. Maybe if I saw you a few months ago, you would have said, you know what, this isn't working for me. I'm going to see somebody else. The tables would have been turned there. And so I think that's a lot of times, again, people can get too caught up in, yes, it does feel good to help somebody like that. A lot of us as coaches and rehab professionals and people that help people in a service industry, we go into it part of it is selfless, but part of it is selfish. We like the feeling of helping people. And so sometimes you can get too caught up in, well, I did that, I helped that person, when in reality, maybe you had less to do with it than you are willing to admit.
I guess there's a bit of hubris in there, right? Now, how much of this is on the average, let's say, customer, client that's coming in? Because I'm guessing a good portion of the people seeking physical therapy and other allied healthcare are not people who are physically active, not people who are strength training, which kind of goes into the healthy stuff, but maybe they've been in a car accident. I think that's a very common word. Or they've sustained a workplace injury and they have the belief, the idea that, well, if I go to physio and they hook me up to this machine or they do this thing on me or this intervention, that it's going to fix my issue. And I think sometimes people definitely go into, well, I've got this problem, I'm going to go see my chiropractor and the chiropractor is going to fix it. Now, oddly enough, I know lots of people who've got into a chiropractor and they swear that they feel better. So How much
Yeah.
of this is the consumer belief, and then what's going on where they're actually walking out feeling fixed?
I think they just are intertwined. I think it's just hard for not to be intertwined. And to go back to your first part you were saying about this is it really does have to do with the demographic that you see, because I've worked in a clinic where I would see anybody and everybody, people who are active, people who are extremely sedentary, people who had a bunch of medical comorbidities, all that stuff. That's kind of like a classic if you're working in like a outpatient clinic as a physio and you get sent people, right? A lot of people don't want to be there. They just don't want to have the injury that they're dealing with or the pain that they're dealing with. And so it's a tougher sell for those people because they don't want to be there. They want to get this done as soon as possible, go back to their lives, and then just keep living their life how they were living. And so that's tough because they're already going to kind of come in with this, like, I'm not looking at this from a lifestyle perspective. I just want to get over this and go back to whatever I was doing. This is not interesting to me. Now, some people you can actually change, which is really cool through your time working with them. But some people you just kind of have to like realize like there's only so much I can do here. You know, you could lead a horse to water, but you can't get them to drink. So you can help them as much as you can. You have to kind of read the person. Does this person really want to make these lifestyle changes, or they just want me to help them with some pain relief as time goes by and they start to feel a little bit better? Like, you know what I'm saying? You have to kind of read that person. Now, the other aspect of this is that now I work with people who seek me out, and most of them are really involved and really want their health to be as optimized as possible. They already understand that it's probably going to be a little bit of a journey. So their belief already is, hey, I need to do whatever I can to help myself be better. And, you know, in this process, I might have reached out to you for this back pain that I have. But, you know, I also have this other little aches and issues that I want to deal with. You know what? I also have been really wanting to start working out and getting stronger again because I'm getting a little bit older and I'm going through menopause. And so there's all these things that it depends on your demographic and who you're seeing in what situations. Um, and to kind of highlight the last thing you were saying about like people that actually go in and do feel better or feel fixed. Um, Again, there's nothing to take away from the fact that there are a lot of manual therapies and things we can do that can really help people feel a lot better. And that's totally true. It's not all placebo. But I think what a lot of people don't take into account is that a lot of it is placebo. It's placebo with effective treatment. Sometimes it's more placebo than it's more of like this like objectively effective treatment. Sometimes it's more objective than it is placebo. People go in doubting, and then you're like, oh, I feel a lot better. Sometimes people go in thinking like, oh, I just give this one thing, I'm going to be better. And maybe it's really not the most effective treatment, but because they're so strongly held onto this belief, it's going to help them. That's super powerful, and people don't realize how powerful that actually is.
Expectation effect, placebo effect is really potent shit. And then there becomes the whole ethic, like it's so evidence-based and it becomes this discussion, well, about the ethics around it. And I suppose if you have a situation where someone is doing something that has some benefit, it's magnified by placebo, and the person leaves feeling better, and it's not economically predatory. I think that's kind of maybe the big magnifier. It's like, okay, cool. You get someone who's got like endless resources and they decide they want to drink, let's say BCAAs, right? Okay, cool. Like you enjoy flavored water, or whatever. Whereas like you got some kid who is scrimping to be able to save up this thing that they think is the big difference maker when it comes to building muscle mass. Like those are two very different, scenarios, right? So I think the cost relative to someone's means, I think is actually a really critical aspect. And I'm not advocating for things that are, I would never advocate for a sham, but as you said, a lot of these interventions do work quite well, even if they temporarily relax the neural tone of a tense site, which downregulates pain, which then can allow that person to move into it, strengthen it, which is one of the best things we can do. And that it's part of a positive outcome. And the allied healthcare professionals, the physical therapists, the athletic therapists that I work with, they practice and preach this.
Yeah, I totally agree. And to your point about the means, yeah. So I've worked with people who, again, and I'm sure you have too, where like they only have a certain amount of financial means, and so they're asking like, oh, I've been saving up for this thing, should I get this? And because I know their situation, I would be like, you know what, don't waste your time. Like there's so many other things we can do that are much higher value and much lower cost, right? But then I've had people that are really well off people who, I want like to do everything that I possibly can. I've really heard good things about this thing. Is there any research behind that? I'm like, yeah, there is some. It's not actually that great, but you know what? If you like it and you feel like you want to try it, and it's not going to, again, put you in some sort of like financial hardship situation, go ahead. Like if it's not going to harm you and it actually might cause some benefit and you are really interested and like you keep bringing this up every time we talk, like maybe it's something you should check out, So that's a huge part of it. You're going to say something.
It's funny, that you keep bringing it up. Like, trust me, we've all had these days where we have an itch to scratch. I was having a conversation with a client, and it's like there was a video game, Red Dead Redemption 2. This is totally off track, but it's actually relevant. And, I was thinking about getting another game, and okay, I've heard great things. Everybody's raving about this game. And I start playing it, and my God, the game mechanics are terrible. I don't understand how, like, someone's going to message me, just be totally offended by this. They're very clumsy. They're very hard to get through. The introduction and the tutorial, the first like main thing, is so painfully slow that I just gave up on it. Now I spent about $80 Canadian on this thing, and as far as I'm concerned, it's a sunk cost. I mean, I'm not going back to this game. And then so I was telling the client this, and he's talking about how great it was. So he recently went back and played it. He's like, "Oh my God, you're right." So, and he was like empathizing with the fact that, like, yeah, this opening of this game was actually quite awful. And anyway, but it illustrates that point, right?
For sure. And I think that's a thought that I had in my head earlier about what you were saying about the certain treatments and the beliefs and things going to. But to your point, what you just said, like that's that nostalgia effect, right?
Yeah.
You remember something being amazing, and then you go back and like, oh man, I wish I would have just not gone back to that thing. But that's totally separate conversation.
Yeah.
But I know what you mean. So a lot of times where I've been in the clinic.
No, you first. You first.
I was gonna say I've had times in the clinic where I worked with somebody and they've been all high and mighty on ultrasound, which you've probably seen us post about that in the evidence-based community, where it really hasn't really shown to do much. People listening to this, ultrasound obviously for imaging purposes and stuff is helpful, but for like actual like tissue healing and stuff like that, like yes, it does give some heat to the area, but really it hasn't really been shown to be any better than placebo in like almost every single study. But some people come in thinking like, that's really what I need. And so there is this argument I've seen online, and I've talked about this before, where some people go, well, you know what? Why does it matter? Because if they're going to get better and the placebo effect is that strong, like why not just do it? And so I think that you need to expound on that a little bit more, because I'm not just going to give somebody to somebody and not talk to them about the efficacy of that treatment. What I've done when I was a brand new physio and that someone would ask for that, I would probably at that point say, this hasn't been shown to be, I would have talked to them about all the research and all, and they would have just been like, screw it, I'm out of here. Now, if it was to me today, I would say, I hear you really want that. We can totally do that. I just want to let you know about the research on it. It shows this. Would you still like that treatment? If it's not going to harm them, then I will give them that treatment because they really want that. And maybe in their mind still, they're like, this guy doesn't know what he's talking about. This is going to help me. I'm not going to fight somebody in like a 30-minute to an hour-long appointment about the efficacy of ultrasound. However, someone could also make the argument, which I don't agree with, that, hey, if placebo is that strong, why not play up the benefits of it and increase that placebo response because you're telling them how amazing this ultrasound is. And they say, what's the harm in that? You're helping them. And I go, well, not really, because you're lying to them. You're not being forthcoming about what the evidence actually is. I'd rather tell them like, hey, I'm on your team. I want to help you here. But let me tell you where we can spend most of our time. And for sure, if you want to do this. And I had a mentor who one time told me that like, if someone is really hard-headed about that stuff, and that a certain sort of strategy is going to be better to help them recover, but they are like dead set on like, I want to do this thing for 8 weeks or 6 weeks or whatever. Sometimes you can bargain with them and go, hey, you know what? Let's do this for a few sessions and spend most of our time on this if you really want to do that. If it's not showing you the effect that you want in this amount of time, can we try it my way? So you can bargain with people too in that way. So that way they feel like you're on their team and you're listening to them, but you're also still explaining to them what you think would be best and you're still being professional about it. And I think that's the best way to go about it, in my opinion.
You're giving them autonomy and choice over the course, right, of treatment. So that's proven. That's great in coaching as well. Let's dive deeper in a couple of things. So first part is, how does being healthier improve recovery from injury? Like, and everything we're talking about, for sure is statistical bell curve. You are going to have super healthy people that have just like acutely horrible shit happens to them, right?
Yes.
And then you're going to have the people who have the most unhealthy lifestyle possible, and they live to be 100, and they just seem to be fine. These are extreme outliers. Okay, dispensing with this
Yeah.
in these anecdotes, what is it about just healthier behavior that actually promotes better recovery?
There's so many ways I can go about this. But when it comes to like tissue healing, for example, right? If you have a circulatory system that's functioning well, if you have nutrients that you're providing your body, you have hydration that you need, just on that base level, you're going to recover better from an actual tissue injury because you're providing the nutrients and the building blocks to recover. If you sleep better, you're going to recover better. Everybody knows if you sleep better, you're going to recover better. If you're not as stressed, if you have a strong social support, if you're hanging out with people you like who are positive, your mindset's going to be more positive. So these are some of the big things. And then you can go into like more of the rabbit holes, like systemic inflammation. If you are somebody who is extremely overweight, chronic stress, all that kind of stuff, that's not going to help you feel better. That's going to wind up and sensitize your nervous system. So not even tissue injury, we're just talking about sensitivity to pain. Everything's going to be heightened when you're not taking care of yourself in those ways. And again, there's so much more I could talk about that, but I don't want to kind of go too far down the rabbit hole with that, but you get the point.
I mean, it makes intuitive sense, and I think that there's always going to be a corner of our industry that it comes from usually a very empathetic place, and they in the advocacy for people who probably often through no fault of their own may be quote overweight, metabolically unhealthy, and then I find though that they push back and they're very uncomfortable with things that I think are pretty fact and evidence based like this, and it's like, hey, if someone is dealing with a lot of these injury concerns, then getting your metabolic health and, dare I say it, you lose the excess body fat could be a potent intervention even of its own, right?
Yeah, I think I know you've probably experienced this a lot and seen things online about this. Like, I feel like it's okay to be empathetic and understand the struggles people are going through and not be as black and white with like, again, to put this bluntly, like, oh, you're fat, you're not fat. I think that's been so stigmatized based on aesthetics that we discount the health behind it. And again, that can get twisted too, because people tend to think, oh, this guy's ripped or this girl's ripped. They're in great health. When in reality, someone with a little bit more body fat's probably in better metabolic health versus being extremely shredded. But that's just not what's been planted into our brains since we were born. I think kind of talking to somebody about maybe the struggles that they're dealing with, but also being like, hey, we're not saying you need to be like in a bodybuilding competition, but like, here are some factors that might be contributing to your issue. I'm telling you all the factors. I'm not attacking you as a person. And honestly, most people in this situation that I've experienced or I've talked to, they know they need to do something about it, but they also know how hard it is. So a lot of them, again, they don't want to really bring it up. They'd rather have other things they can focus on. And I understand where they're coming from because that's a long journey. But if you start that journey, even if you don't have to be at the end goal to appreciate those benefits, you can be in that process, even just a few months in, and start to notice that you're feeling better. You can move easier. You have less pain. Those aches and pains you've had for a long time aren't there as much anymore, or they're gone. So I think highlighting that stuff, like you said, while being empathetic is a big part of the process to kind of help the coaching effort be effective and be collaborative.
I love it. All right. Next part I want to dive into. So I mentioned in your original post, you talked about repetitive movements and sustained postures. So I'll sort of tie this together. I'd like you to, if you can, elaborate on the evidence where repetitive movements and sustained postures are injury mechanisms. Now, there's a second post. I think it ties in, so I'll lump them. Quote, slouching in front of a computer isn't the problem. Text neck isn't the problem. Anterior pelvic tilt isn't the problem. Spending too much time in any position without moving into other positions is the problem. So can you tie that all together?
Yeah, I mean, to put it in a nutshell, when it comes to like sustained postures, for example, your nervous system, again, going back to the nervous system, is our body wants to move, not only because it just helps provide more blood flow, provides more oxygenation to our nervous system, but you think about things like repetitive, like our nervous system, our nerves don't like to be pulled, don't like to be compressed for long periods. They like to be moved. And it's not just our nerves, it's also our joints, it's our muscles. Things like to be moved. Now, it doesn't mean that you can't hang out and relax and lay on the couch and watch a movie, but it's when you're in the same position over and over and over and over again. I wouldn't necessarily say it's a higher in that moment injury risk. I think it contributes more to like increased pain and discomfort. And I think a lot of times those get pathologized as, again, like you have forward head syndrome, or you have text neck, or you have anterior pelvic tilt, whatever. And yes, certain positions can be more uncomfortable for certain people. And yes, we do see a lot of patterns that come to see us in the clinic or that seek help. But that doesn't necessarily mean that those are pathological issues. It's just, I've also seen people, maybe it's not as common because most people don't do this, but someone can be spending all day because they saw a post on YouTube about their posture and how it's screwing up their life. And then they're sitting up all day in a military posture. And then they come in to see me talking about how they have pain in their upper back or their shoulder blade. And they need to learn how to relax and slouch because they're spending all day tensed up in this military position. And so, again, that's not seen as often, but I think that the point that's illustrated is that, again, any position just not moving from when you're doing repetitively, your body's going to be like, can we like move around more? And that's why, and a thing that I explained to some people too, this is going a little bit off topic, but like if you're somebody who's a desk worker and you spend long hours in front of the computer, you have multiple screens and you're always busy and you're not really getting out and taking movement breaks. A lot of times these people will ask me, hey, after I finish working with you, like I'm feeling a lot better now. Do I need to keep doing this stuff? Or can I just like stop and go back to my life and I'll be fine? And it's like, well, think about how you got here. It's because you weren't moving and you were stuck in that position for a long time. We can't just stop doing what we were doing or the same problem is going to happen. You have to take the tools that I've given you and utilize that into your lifestyle. Whereas maybe somebody else who is a construction worker or something, and I give them some things to work on, maybe they don't need to do the specific things that I give them. Now, of course, being a healthy person is still important, but maybe the specific things I gave them to help them get out of the situation, they're already moving around all the time, doing all sorts of weird, random things, depending on whatever site they're on. They're not in these postures and positions all the time. So they're a little bit different scenario. To kind of go back to what we were saying, the prolonged positions and the repetitive movements, again, like repetitive, we all kind of know, like overuse repetitive things can cause a problem. That's why, like, even in sports, cross training is helpful, but it happens in everyday life too. If you're doing some sort of job or if you do something over and over and over and over and over again, sometimes you need to learn how to do that thing where you can decrease the stress in a certain area. You do it slightly differently. Maybe you need to, again, take more breaks from doing that thing or do some sort of cross training or other sort of training. You're working other areas of your body and that same area over and over and over again. It sounds super obvious saying it, but it's sometimes not as easy for people to recognize when they're in their life doing the thing until you bring it out to them and they go, oh, that makes perfect sense. I'm doing this over. No wonder it hurts, you know? I don't know.
Very well. There's an aspect of load management to this, and I've talked about that recently with Adam Meekins and some of the other episodes I had, and anybody listening to this who's enjoying this conversation will enjoy those. But if you think about it, so repetitive overuse is in a way a load management issue. It's probably too much load intensity, volume of something. Now, you also mentioned the construction worker. It made me think of one of my clients, and he owns a contracting company. So his stuff can vary from sitting in a vehicle driving around all day to, physically knocking down walls or other, sometimes putting in bathtubs and showers. And he's a big, powerful guy. But he's definitely noticed that he feels better now that he's back strength training with me. He was one of my first clients ever and returned after moving away. Now he's back the last little while. So he's feeling better. He's lost a bunch of weight, just feeling good. And I'm sure that also plays into it. But he does have some things that flare up. And so if you've got someone who's got a lot of variability to their work, there's also the issue of if you have large spikes in load and intensity of that variability that they're not exposed to. So you kind of get it on both ends, but if you think about it, it's really just too much load, too much intensity
too much volume
Yes.
of something relative to what you're conditioned to handle.
Yeah. I think in orthopedic physio, I don't think people respect how much, in the grand scheme of things, how much that explains so many things. And you said it very well. So it's like the analogy that I often use with my clients is something that I think was first coined by Greg Lehman. And it's the cup analogy, where it's like, if you have a cup, if you have an espresso mug that's tiny, and you haven't built up the capacity, that's your capacity for an activity, right? You go to that activity. If somebody starts pouring the water or coffee or whatever into that cup, and that's you doing that activity, but your cup is, the capacity is too small, and that starts to overflow, you can have pain and or injury, right? So part of it is you need to manage how much of that activity you're doing based on what your capacity can handle, the load management, right? But then part of it is you need to do things like strength training and build up your body so that cup gets bigger and bigger and bigger. So now when you do those activities, much less likely to have pain and injury. Now, of course, pain, I'm not at all saying that pain is just you're stronger, you have less pain, but you know what I mean? So when things, especially like tendinous type of things, like the capacity of a tissue to tolerate load, if you build that up, capacity is much higher. That cup is higher. You can keep pouring into that thing all day and you might not even have any issues versus somebody who, and you could also build yourself up for a certain task. Like you said, I mean, you go to do some random task you haven't done. Perfect example for me. Let's use myself. I strength train regularly. I feel like I'm in pretty good shape in this point in my life, even with young kids. And it's not ideal, but I feel like I'm in pretty good shape. But I have not really worked on much plyometric or agility type of activity. I used to for many years as a basketball player, but it's not really a priority in my life. I don't really need to use it very much. Recently with family, went to Sky Zone, which is like a trampoline park, and you can jump off of walls and you can dunk on the basketball hoops there. And I was having a blast. I was just trying to be a little kid with my sons, and I went a little bit overboard. It was too much, too fast. My body is not prepared for that activity. I have an old knee injury that I flared up and it was swollen for like 3 weeks because of that. Now, if I would have planned that better and said, okay, I have this thing coming up, let me start working on box jumps. Let me start working on these activities where I'm doing more power movements, where I get my joints, my muscles, my tendons prepared for this activity. Again, I didn't take it that seriously, but if I did take it that seriously, much less likely that old injury would have flared up. That's a perfect example of that.
Totally makes sense. I've got a client. She recently just went and played a whole bunch of softball after probably not playing any for a year. She's going all out, and she's not in her like early 20s anymore. And sure enough, pulled hamstring. It's like almost a guarantee you go and play that first softball tournament. And because it's not just one game, usually it's like 4 across a day. I don't know if there's any booze involved in this. I don't think there was, but I mean, I remember the old tournaments of the old company. It's like there was plenty of drinking. You're out in the sun. It's a cocktail for it. Like just every injury mechanism, possibility is just present. Okay, let's go into this one. Does exercise technique matter when it comes to pain?
Yes. So I don't know if you remember, by the way, I made that post after we talked about it 3 years ago. I made that post and I remade it recently because I'm like, I could probably highlight some different things here a little bit differently. It's so funny that you brought that up. So exercise technique does matter when it comes to dealing with pain or at times decreasing injury risk. But the nuance there is that there could be overtraining. There could be, again, your individual anatomy, how you perform the exercise could be different between different people. People can kind of go off the rails with this sometimes and say, like, it doesn't matter at all. Like, just have somebody just do whatever they want, which I think maybe when you're talking about in some stages, depending on the person you're dealing with who overthinks things, you need to kind of like back off more. But I take the approach that if like you're working with somebody who is brand new to training, yes, you want them to have like the basics of technique down for whatever their goals are. And even if their goals are very generalized, you don't want to have them just go willy-nilly and do whatever. But I don't know who first said this. I kind of subscribe to too, is if it doesn't work, if it doesn't look perfect, I'm not going to sit there and not let them exercise for an hour just trying to get their technique perfect and show them every little cue. If it looks good enough, I'm going to let them go for it. Now, obviously, as they get higher level, And as they start to get more towards their maximal loads for whatever repetition maximum they're working on, then yes, you might want to fine tune the details more. And again, when it comes to performance, like what sort of muscles are you trying to hit? What sort of things are you trying to accomplish? Then yes, we can really tack down and really be very strict more about the technique, especially if somebody's asking for that. But I think for like the average Joe who wants to go in and just be stronger, wants to get in better shape, wants to do all this stuff, like we don't need to be as hyper focused on everything being perfect. It needs to be, if there's some like glaring deficits, of course, address them. But I think a lot of times people get way too into the weeds when that probably takes away from it. That benefit you're getting out of slightly changing technique a little bit more is probably taking away from the benefit of them just training harder.
I've noticed for years where if I've got a client who expresses some sort of discomfort as they're moving, then I can see visually a body position. So oftentimes it's this like mythical neutral spine thing. Here's the crazy thing. If I've got someone doing a Romanian deadlift or, bent over barbell row or something that, classically we say, hey, you're supposed to maintain neutral spine. And they're either not maintaining that neutral spine position, or B, too rounded or too extended, overarched. And then they express discomfort. And then getting them a simple cue of, okay, lock your ribs down to your pelvis, which of course, what does it do? Braces abdominals. I think the core brace is probably the key rather than necessarily a position, but all of a sudden, whoop, discomfort gone away, right? So it's like, okay, well, was it a technique issue? I mean, as long as you're using appropriate loads, I think a lot of what we see with injury risk and what like form breaking down is a load management issue. It's someone's using too much fucking weight compared to what they can control. And then all of a sudden the form just looks like shit. And then, yeah, there's an injury mechanism there, but is it because it's the form? No, it's probably because of the load, right? But I can't count the number of times that, okay, somebody expresses a little discomfort. Oh, my knee doesn't feel great doing this. Cool. Let's change A, your foot position, or B, let's just change something about the way you're engaging. And all of a sudden, discomfort gone away. All right, cool. Right. So there's clearly some way that the force is on tissue that the tissue doesn't like. We engage something, we change a position, it seems to feel better. It's like, that's coaching, and that's very universal. So, I mean, that does come under the umbrella of, okay, technique, right? And you mentioned, you didn't use the word, but anthropometry. There's sometimes you just don't force the 6'5" guy with really long femurs to barbell squat below parallel. Usually that just feels like shit, right? Usually they can't maintain a neutral spine in doing that. And again, like if your spine is like going from an arch position into a flex position without good control with a lot of weight on your back, to me, that probably isn't a good idea.
Yes. And that's a great point. It's like, was it because I changed their positioning, or was it because I just changed how they engage their muscles? And there's so many things that you can modify. And some people don't like to hear me say this, but yes, we can recognize things from coaching for long enough or treating patients for long enough that there are certain cues or certain things that they hurt with this thing. I've seen this a million times. We do this thing, is probably going to help them. But a lot of times it's more like, it's like educated trial and error. Meaning when it comes to like pain. So it's like something might hurt and then you go, okay, it's probably this thing. Okay, that doesn't feel any better. Oh, it feels worse. Okay, what else could it be? And you're just trying different things with them. And sometimes people kind of confuse you. Like, they don't really understand it. I've even told people, like, I'm not quite sure why that feels better, but let's do that. It feels better. Who cares? You know what I'm saying? I don't think there's any sort of increased injury risk for you, and this feels better. So let's do this thing. Now, obviously, you don't want to be saying with every single person that you're seeing, like, I don't really know. But I mean, just my point is that happens sometimes. It's okay to admit, like, I'm not quite sure why that feels better, but like, whenever we tried it, that's awesome. That feels better. I think the other thing I wanted to kind of riff off from what you just said was like, if I'm working with somebody who doesn't have any sort of like injury or pain sensitivity or anything, I'm less concerned with if it comes to like they have a specific goal with their physique or things they want to try to hit, then of course I'm going to be trying to make sure that their form is optimal for that. But when it's more just like, hey, I just want to like do this exercise and lift weight and be healthy, that if I don't have those issues, then I'm not going to focus too much on the little details. When somebody has back pain or knee pain, then knowing, and this is where I think a lot of strength coaches are really good at this, but I think even as a physio, just knowing what tissue is loaded in certain ways and okay, this makes sense that this would cause this. Okay, here's little tweaks you could make to take stress off that area. Here's little things we can do to allow this to be performed more comfortably. You know what? This exercise probably isn't the best exercise for you because it's loading your body and that region in this way. I think that's where I get into more detail. And even with the people that I work with online, I always tell them, like, when you send me videos for feedback, don't just send me a video only. Send me a video and send me your text or voice feedback about how that felt. Because I might watch a video and go, that looks really good to me, and move on. But if they go, you know what, this really hurt my hip when I did this, or this hurt my shoulder when I did, and then I know, okay, where did it hurt? Okay, it hurt here with that exercise at this point. Now I watch the exercise with a different context, a different lens on, because I'm going, that hurt them, and that's this exercise. I know how that loads this tissue. Oh, here's what you can do slightly differently. Or you know what, I noticed you did this, do this instead. Oh, that feels so much better. But I wouldn't have given them that feedback if I didn't have their feedback about how they felt with it. If they said this felt totally great, it wouldn't have said anything. And sometimes people can't wrap their head around that, but I think that's where the context of what the person is actually wanting and feeling with the exercise is important for what feedback you give.
There's a perfect illustration of this, and it's come up so many times, including with me, is your knees should be able to cross your toes as you squat. Absolutely, biomechanically, that's what we want. However, you sometimes have situations where someone has knee discomfort when that happens. Now, maybe it's an ankle mobility issue, maybe they're coming off their heels, which isn't necessarily injurious at all. I know lots of people, my buddy Gerald Mays, he does a lot of like squatting on his toes. That stuff's fine, theoretically, right? As long as your knee has built up the tolerance to the force acting on it, load management again, right? It seems like everything is load management. What I found, I had a client recently, he likes to barbell squat, but his knees were bugging him the last couple times, and we'd warmed up through and he wanted to keep pushing. So, he comes in, his knee was bugging him after the last time we did. So I said, okay, we're going to change something here. And I just had him split squat with a more vertical shin, rear foot elevated split squat. And great. I also like box squatting. If I can get someone to hinge a bit, sit back onto a box bit, slightly more vertical shin, hey, no discomfort. Super. So this client, this young man, is like, legs were like wrecked for 3 days in like a good way, not too much, but he's like, it felt great. He had zero knee issue. Are we training the quads effectively? Absolutely. No problem whatsoever there. We're just avoiding this one thing that seemed to piss off his knee. Right? Simple solution. You're getting the same training effect.
Totally agree. And I think people don't, and think people will like really know how valuable it is just to make tiny little tweaks in understanding load management as a whole, but also on individual areas and how much that can help things feel better. After that trampoline incident, like I was telling you about, I was doing rear foot elevated split squats, and I typically actually had been doing them with my heel elevated to get more of a knee dominant, quad dominant split squat. But that day, I was like, that's not going to happen. So I sat back really far, big forward trunk lean, sat back vertical shin. Definitely felt it more in my glutes, my adductors. Didn't feel much in the knee. Still could load pretty heavy. Had a great workout. So it's nice to be able to have those modifications on the fly, and that's where that stuff can be really valuable.
Beautiful. All right, a little bit more time here. So I want to go a little bit deeper on some of the other factors that influence pain. And this is part of a post you had. You just talked about high stress, anxiety, depression, toxic relationships, feelings of hopelessness, dwelling on the pain, lack of social support. Can you kind of wrap that up into how these things can influence your experience of pain?
Yeah. So the way that I describe it to people that I work with when we're having trouble figuring out maybe the mechanical or the classic things that they would think are influencing their issues, is all of these things that happen in your life, whether it's stress, whether it's your mood, whether it's just not being happy, whether all that stuff, previous injuries, previous like thoughts and emotions and beliefs about what you're going through, and maybe you're catastrophizing your situation that it's worse than it is. All that stuff is processed by your nervous system. Even what you feel is processed by your nervous system, your brain. All those neurons are in these separate pockets that aren't connecting with each other. There's all these interconnections between different areas of your brain. So brain is a stigmatized thing. People think, oh, you're saying it's all in my head. But it's like, no. The sensory impulse you get when someone pinches you, for example, it goes to your spinal cord, it goes to your brain. It comes back out. Your brain has to decide, do I need to produce pain in this situation or not? Most people don't think that's how it works. They think, oh, I got pinched, it hurts, ow. But if someone had a gun to your head at that point, and was going to shoot you and someone pinched you at the same time, you probably would be barely feel the pinch because you're trying to see, is this guy going to pull the trigger? You're focused on something else. So that's an exact, that explains that like all this stuff has to be processed in your central nervous system, in your brain. So if you have these negative thoughts about your situation, if you think that you're doomed, if you think you're never going to get back to the activities that you want to do, if you don't have a positive social support and you feel like you're isolated in your recovery process, all these thoughts and emotions that are making things worse are going to, or not going to, but they can contribute to how you feel physically. And one stigma that I hate, but I understand why people feel this way, is people think that it's like you have this somatic pain or the psychosomatic pain, meaning, is this pain actually real? They actually will say that. Well, my pain is real. I know that my stress plays into it, but it's real. And I'm like, what do you mean it's real? It's all real. All pain, discomfort is all real. The things you're feeling are real. Now, if your version of what you mean by real is, do I have a tissue injury or is there something happening in this area that I feel it, then that's a different conversation. But we talk about if it's real or it's just as real if you don't have any sort of tissue injury versus if you've your arm sliced open and it hurts because of that. And all those chemical irritants and mechanical irritants in that area. It's just that I don't like how people try to differentiate between whether it's real or not, or psychosomatic, or typically it all is going to be contributory to some degree, but it's how much of that pie chart is it because of maybe this acute injury, or how much of it is because of other things going on in your life? Is it multiple things that are very evenly distributed, or is it kind of the pendulum is on one end much more than the other? And so as a physical therapist, as a physio, I have to figure out what things do we need to tackle more. Because there are some people where maybe they have some fears, maybe they have some worries, but like they have this acute injury that is a big issue that we really need to focus on that tissue. And yes, we need to talk to them and help them with other things going on in their life and address those things. But I can't sit there and talk about that they broke up with their boyfriend or girlfriend when they have this swollen knee in front of you. So like maybe it's something we could talk about later, or I can empathize with them in the moment for a few seconds, but we need to focus on the issue at hand. Whereas maybe someone else is a situation where maybe months down the road, that same person isn't an acute issue anymore. I've done all these tests. I'm checking how their knee is functioning. And I'm like, you know what? The actual tissue is in great shape, but you still have a lot of pain there. There's stuff that we need to unpack that might be contributing to this. Are you fearful that you're going to re-injure yourself? And that's why maybe you have more sensitivity in that area because you're trying to protect you because you think you're going to re-injure yourself and you don't want to go back to that place again. Again, it sounds very woo-woo, but it all does play into it.
It makes a lot of sense. That topic probably requires, a course, let alone, its own episode, but, certainly like more in-depth education. I think we don't believe we can do it justice, but I think this whole episode has done a great deal of justice to the topic at hand. So people can find you on Instagram at dr.caleb.burgess. So at dr.caleb.burgess. Are there any other resources you would like to point people to?
I mean, my website's not great. It's really just to point people to my social media and if they want to work with me. So if anybody does want to work with me and I have a spot available, go to my website. You can go to social media and there's application forms you can fill out. I also have a app. If somebody doesn't really need the one-on-one support and they want like certain programs to work on mobility of certain areas, full body mobility, there is a strength routine. I need to probably build that out a little bit more, but there's also programs for more specific common issues, whether you have like a rotator cuff problem or chronic back pain, hip impingement issue, you have a variety of knee issues. There's programs in there that you can work through, which of course they're not perfect because they're not individualized, but they can help a lot of people. And you have access to me on there if you needed any additional help with modifications of exercises or questions about things. That's something you could check out too.
And you approach your social media very much like me. And this is actually kind of a cool thing to highlight. When it comes to social media, you are getting often a pretty superficial touch point that is meant to be a bit of a broad capture for people, right? To get people's attention. But then that can help direct people to the deeper resources, the podcasts, the articles, that sort of stuff. So you and I tend to approach social media a very similar way. And I recognize that for what it is. Now, I do also appreciate the people who I mentioned Adam Meekins a couple times, and again, I'll direct anybody who's enjoying this definitely would like his episode. I find that he's able to do a pretty good job of going a little bit deeper, but oftentimes this is the dose of stuff that gets people in the door to start changing the way they think. And then often enough, a lot of these posts actually have nuance and depth to them that can really change mindsets and help people. So, and getting a steady drip of it almost on a daily basis can go a long way. And this is sort of you sometimes get the fitness professionals who get very negative about social media, or they just like complain about influencers, the people who are sharing bullshit information. And this sort of becomes a narrative not to be present at all and just kind of be resentful of the people that, the thing that they think these influencers are getting out of it. But, I still like showing up on social media, and all of the positive stuff that comes from it has been net positive for me. And I like sharing people who do a similar and better job like you. So, because you've accumulated a very large Instagram following, certainly. So I appreciate that. Now, further thought, if anybody has found this episode via your media, I would love it if they would check out other episodes. This is definitely not a physical therapy podcast, but I just seem to have had a number of great people who are that intersection of great coach, great strength coach, great physical therapist, the evidence-based stuff. And again, recent episodes with Dr. Sam Spinelli, Dr. Susie Spurlock, Adam Meekins, Dean Somerset, while not a physical therapist, certainly is great in that realm. There's been several others. So I would love it if you guys check some of this stuff out. And please message me if you want more specific recommendations based on where you are. Please go follow Caleb. It's great to have you back, my friend. Thank you so much for taking the time.
Yeah, for sure. It was great.